Now, let's continue with our discussion with your irreversible injury. Actually, guys, I'm already done with my video recording. However, when I check the video recording, wala siyang audio. So, I have to repeat this part. Buti na lang talaga, kinakat-cut ko siya. So, from the start. Anyway, at least, ulit na, konti na lang man to. Madali na lang to. Sige, let's continue with our discussion. So, we have your irreversible injury invariably leads to cell death, which goes on either apoptosis and your necrosis. So your irreversible injury is now your cell death. So it's either apoptosis or necrosis. So let's define first your necrosis. Pag sinabi nating necrosis, it's a major pathway of cell death in many commonly encountered injuries. Can be brought about by your ischemia, exposure to toxins, infections, and trauma. It is always due to a pathologic process. Remember that. Lahat ng necrosis is always by a pathologic process. Pag sinabi natin pathologic process, we are referring to a certain disease. So lahat ng necrosis is brought about by a certain disease. Apoptosis. It is what we usually define as your programmed cell death. So cell kills itself, caused by deprivation of your growth factor in cells. DNA is beyond repair. So there is nuclear dissolution without complete loss of your membrane integrity. It is active, energy dependent, and tightly regulated cell death. In comparison to your necrosis, your apoptosis is not only all the time physiologic, pwede din siyang pathologic. So meron tayong mga pathologic conditions that will also lead to apoptosis, but necrosis will always be pathologic. So ang apoptosis either physiologic or pathologic. Now let's compare our necrosis versus apoptosis. So this is the basic features of necrosis and apoptosis. So this is how we compare necrosis to your apoptosis. So this is at a cellular level. Tingnan natin. Pag necrosis, ang nangyayari, there is cell size swelling. Lumalaki yung cell. Pag necrosis, lumalaki yung cell. Anong nangyayari sa nucleus? Ang nucleus din natin, it undergoes three processes. Sinabi nating pycnosis, then it will proceed to karyohexis, then to karyolysis. Ano yung pycnosis? Pag sinabi nating pycnosis, is actually nuclear shrinkage. Lumiliit yung nucleus. Then, it will undergo your karyohexis. Pag sinabi natin karyohexis, your nucleus becomes fragmented. It will undergo fragmentation. Then lastly, it will undergo your karyolysis. Diba? Pag sinabi natin lysis, it's dissolution, meaning it is already the destruction or the dissolution of your nucleus. Diba? Sa necrosis, meron tayong mawawala na yung magdi-disintegrate na yung ating nucleus. Kaya nga sa ating example or picture kanina sa irreversible, anong nangyayari sa ating nucleus? Na di-disintegrate. There is already nucleus loss or nuclear loss. Nawawala na yung ating nucleus because of the three important process. Pycnosis, shrinkage, karyohexis, fragmentation, and lastly, your karyolysis, dissolution. Kaya sa ating irreversible, nawawala, there is already loss of nuclei. Next, your plasma membrane is disrupted. Anong ibig sabihin, Doc, pag disrupted? Remember, your cell size. Ganito yung cell. Pag mag-undergo siya ng necrosis, lumalaki yung ating cell, right? Lumalaki yung ating cell. So what will happen? Will our plasma membrane integrity still intact? Of course, madi-destroy siya kasi lumalaki. So your plasma membrane becomes disrupted. So anong mangyayari pag destroyed ng ating plasma membrane? Lumalabas yung ating cellular contents. And also, there will be enzymatic digestion. Because of that process, lumalabas yung ating cellular contents. Meron tayong enzymatic digestion. They will cause now your inflammation. That's why in necrosis, inflammation is actually frequent but not all the time. Again, your necrosis is always pathologic. Invariably pathologic. All the time pathologic. So again, let's repeat pag necrosis, actually may mnemonics ako dyan para hindi ko siya makalimutan. Sinasabi ko lang, necrosis, necrosis, negro. So negro, lumaki. So necrosis, negro. So in short, there's cellular swelling. Tapos, di ba, pag may cellular swelling, alam natin na nadi-destroy yung plasma membrane. So that's why your plasma membrane is disrupted. Tapos lumalabas yung mga cellular contents. Dahil lumalabas yung mga cellular contents, there will be inflammation. Then and necrosis is always pathologic. That's it. That's simple as that. So again, how will you compare that? Now let's compare necrosis to your apoptosis. Sa apoptosis natin, it's about the opposite of your necrosis. So as long as we know necrosis, opposite of that is gonna be your apoptosis. So, necrosis, enlarge. Apoptosis, shrinkage. Iba naman si apoptosis. Si apoptosis, nag-shrink. Yung nucleus din naman, dumadaan sa fragmentation into nucleosome size fragment. Then, plasma membrane becomes intact. Your plasma membrane still intact kasi nga naman nag-shrink lang siya. Hindi naman siya lumalaki. So, your plasma membrane is still intact. Since intact ang plasma membrane, what will happen to the cellular content? The cellular content is still also intact, pero may be released in apoptotic bodies. Meron bang inflammation sa ating apoptosis? Of course, walang inflammation na nangyayari sa apoptosis. So you remember your apoptosis could either be pathologic or physiologic, but most of the time it is physiologic. Pathologic because especially during DNA or protein damage. So again, do not forget the comparison of the two. As long as you know necrosis, opposite of that, that's gonna be your apoptosis. Just remember, necrosis, negro. So yun lang, swelling. Okay, walang silbi. Okay, fine. So again, let's see this diagram. Ito yung cell natin. If this cell undergo necrosis, anong nangyayari? Necrosis, negro. Enlargement. Lumalaki. Then your apoptosis, shrinkage, opposite of that, until such time that it will be released as an apoptotic bodies. Okay, very good. Now let's define your necrosis. Necrosis is a form of cell death in which cellular membranes fall apart and cellular enzymes leak out and ultimately digest the cell. The biochemical mechanism of necrosis, number 1, failure of energy generation in the form of ATP because of reduced oxygen supply or mitochondrial damage. Actually, we discussed this one already, right? Pag mababa nga or there is ischemia, there is reduced oxygen or blood flow, anong nangyayari? Mababa ang oxygen. Therefore, mababa din ang ating ATP. Once there's low ATP, then our cell will undergo cellular death or injury. Next, damage to your cellular membrane, including the plasma membrane and lysosomal membranes, which results in the leakage of your cellular contents, including enzyme. What else? Irreversible damage to your cellular lipids, proteins, nucleic acids, which may be caused by your reactive oxygen species. Actually, these biochemical mechanisms of necrosis have been discussed a while ago. Ano, magaling na kayo dyan. So, now let's proceed with the different types of necrosis. Ano, mas maganda to. Types of necrosis, meron tayong sinasabing coagulative necrosis. So, coagulative necrosis, it is characterized by the preservation of the architecture or outline of the coagulated cells. The denaturation of protein is the primary mechanism which create a delineation of your necrotic tissue in the gross examination. Coagulative necrosis is characteristic of hypoxic death of cells in all tissue except the brain. So yun lang, pinaka-importanting malaman natin sa coagulative, intact yung architecture. There is still preservation of the architecture. Yan yung pinaka-importante. This preservation is brought about by the denaturation of protein. So intact yung ating architecture line. Next, ang coagulative necrosis is brought about by an hypoxic death of cell. All of tissues except sa brain. Sige ha, tandaan natin yan ha. Very good. Yan yung dapat nating tandaan pag coagulative necrosis. Next, tingnan natin. This is a very nice diagram. So, what do you see here? This is your kidney. Because remember, tingnan natin sa histology, tingnan nyo, may glomerulus and there is a corresponding na mga tubules. So this is this is really your kidney sample. So tingnan natin, grossly, ano nakikita natin? This is a wedge-shaped kidney infarct with preservation of the outline. So tingnan nyo, may preservation sa outline. Nakikita nyo naman yung outline because this is brought about by the ano nga ang reason bakit may preservation of the outline tayo dito? Because of the coagulation of your protein. Sa microscopic view, tingnan natin, sino ang necrotic and normal area dito? Yung letter N dito is actually the normal kidney. So this is the normal kidney. And then the letter I here is actually the necrotic cell. So you can see there is a delineation or there is a delineation line. Like the necrotic cells really show a preserved outlines with loss of nuclei. However, di natin makikita yung mga nucleus. Pero according to the book, there is already a loss of nuclei. And also, what you can see here, there are a lot of inflammatory infiltrates present. However, this is difficult to discern at this kind of magnification. Grabe naman, sana sinum nila, no? Pero hindi natin ma-appreciate, kaya ako man, hindi ko man masyadong makita. Pero, see, nakikita nyo, there's a delineation and also, there are a lot of inflammatory infiltrate. Again, ano nga dapat nating tandaan pag coagulative necrosis? Pag coagulative necrosis, intact yung outline. Tapos, ano pa? This is brought about by a hypoxic condition in all tissue except the brain. So, yun yung dalawang dapat tandaan natin, ha? Now, let's proceed with your liquefactive necrosis. So, liquefactive necrosis, it's a characteristics of focal bacteria or occasional fungal infection. There is a complete digestion of cells, transformation of cells into a liquid viscous mass due to the inflammatory response elicited by the microbes. So this is a necrotic material becomes creamy, yellow pus due to the presence of your dead leukocytes, seen in a hypoxic death of cells in the nervous system. Actually, your liquefactive necrosis has the same mechanism with your coagulative necrosis. Bakit? Remember, anong mechanism ng coagulative necrosis? There is your hypoxic death in all tissue except brain. Pero pag ang hypoxic death cell happens in the nervous tissue, that is now a characteristic of liquefactive necrosis. Very good. Again, example ng may mga hypoxic death, may infarct. Ano yung infarct, doc? It's almost the same with your ischemia. There is a blockage of your blood flow. If that blockage of blood flow happens anywhere, then that's gonna be your coagulative necrosis. But if that infarct happens to the brain, if there is hypoxic death cells, or if there's ischemia on that part of the brain, then that's gonna be liquefactive necrosis. Actually, ang coagulative liquefactive, almost the same lang. It's just the location. Pag ang location sa brain, always liquefactive. Other than the brain, that's gonna be your coagulative necrosis. Very good. As what you can see here in the diagram, liquefactive necrosis. An infarct in the brain shows dissolution of the tissue. So that's a very nice characteristic of your liquefactive necrosis, dissolution of your tissue. So this is common in patient who have your stroke. So usually, pag sa emergency room, patient came in, usually pag mga stroke patient, napaka-toxic niyan, guys. And you have to manage that as fast as you can because you want to prevent this to happen because this is already irreversible and we do not want that to happen. Remember, this is brain and it controls different parts of the body. So, kung magkakaroon ka ng problem dito, then you could have a irreversible injury or irreversible damage sa body. So, darating yan. Usually, na-observe namin, there is slurred speech kasi affected yung speech. Then, nahihirapan maglakad. There is weakness on the right side or weakness on the left side. So, ino-observe namin dyan. Sometimes, there is also loss of consciousness. So, we have to really check. Kasi this is very common in patients who have stroke. Example of liquefactive necrosis of patient who have stroke, or the medical term for that is your cerebrovascular disease. Ano nga yung cerebrovascular disease? Yung cerebrovascular disease, cerebro, refers to the brain. vascular refers to the blood supply of the brain. So, the main problem here is the supply of your blood to the brain. Bakit? Because there is a hypoxic event. Ano yung example natin dito? There is a hypoxic event. Bakit may hypoxic event? Ano nga mga ibang hypoxic event? Pwedeng infarct or pwedeng bleeding. So, nilalagay namin dyan, pag may patient na dumarating, we have to assess. Alam namin, stroke na. We will identify bakit nagkaroon ng hypoxic death. It's either infarct or bleeding. That's gonna be the most important tawag ito, differential na aming lalagay. So, ilalagay namin cerebrovascular disease, infarct versus hemorrhage. So, hindi namin alam is if it is brought about by infarct or bleeding. Kasi ang dalawang ito will lead into a hypoxic death. And these two will also have the same manifestation. Parehas na sila, magkakaroon talaga ng stroke ang pasyente. And we really don't want this to happen kasi magkakaroon ng liquefactive necrosis and this is a irreversible injury. So yan, nilalagay namin sa aming initial impression, CVD, infarct versus bleeding. Kaya we will request for CT scan. Sa CT scan, doon na namin malalaman kung may bleed or infarct. Doc, ano po ba yung infarct or bleed? Pag sinabi natin infarct, is just similar with your ischemia. There is a blockage sa ating blood vessel. Diba? Remember, it's a CBD, cerebrovascular disease. The problem is in the blood vessel. Remember, the blood vessel will supply oxygen. Same sila ng mechanism ng dalawang ito, yung bleeding and infarct. There will be decreased blood flow. Kasi sa infarct, may barado sa blood vessel. That's why there will be no enough oxygen leading to liquefactive necrosis. Or sa bleeding, since lumalabas yung dugo sa ating blood vessel, it will not go directly to the brain. Hindi niya masusuplayan ng enough na oxygen ang ating brain. Therefore, it will still lead to hypoxic cell death. So in short, with that, we will request for CT scan. Dapat sobrang mabilis ka. Re-request namin ng CT scan and I just want to show you this CT scan. So ito yung usually nakikita namin. Pag bleeding siya na stroke, ito yon, pumutok yung ugat, nagbi-bleed. Ischemic stroke, ito yung infarct na sinasabi ko. Dito yung blackening, meaning may barado sa ating ugat, sa ating brain. So ang end effect nito is hypoxic cell death and this will result to liquefactive necrosis. So we have to really identify whether it is hemorrhagic versus ischemic because the management will be different. And our main goal really is to prevent the progression of the disease. We cannot reverse it back to normal because it is very difficult. But our main goal here is to prevent the progression of the injury. So that's why sa emergency room, pag meron talaga mga toxic patient, grabe, bilis. May mga times na ako lang yung isang clerk, tapos ako pa yung nagdadala ng patient, patong x-ray, tapos ako pa magre-relate. Grabe, napaka-toxic. You have to really act fast, think fast. I guess you have appreciated your liquefactive necrosis. Now, let's proceed with your gangrenous necrosis. So, your gangrenous necrosis, again, let's review na muna para at least hindi natin makalimutan ha. Pag sinabi nating ako na nakalimot. Pag sinabi nating coagulative necrosis, intact yung architecture and it is a hypoxic cell death outside your brain. Pag a hypoxic cell death within the brain, that's gonna be your liquefactive necrosis. Now, let's proceed with your gangrenous necrosis. So, gangrenous necrosis, it's not a specific pattern of cell death, but usually applied to a limb. So, gangrenous usually applied to a limb that lost its blood supply that has undergone a coagulative necrosis. So, this refer to your dry gangrene. Particularly, so, pag gangrenous usually sa limb and extremities. Patient with a diabetic foot infection can develop into gangrenous necrosis. So usually sa mga diabetic foot talaga yan guys. Ang wet gangrene, so i-differentiate natin ha, gangrenous, pwedeng dry gangrene or wet gangrene. Yung dry gangrene, basta it's not really specific as long as it's actually similar with your dry gangrene, similar with your coagulative necrosis, but applied sa ating limb. Pag sinabi nating wet gangrene, it's also a coagulative necrosis plus superimposed bacterial infection, which is your liquefactive necrosis because of the action of your degradative enzymes in the bacteria. Okay, ulit-ulitin natin ha. Coagulative is a hypoxic cell death outside the brain. Pag hypoxic cell death in the brain, that's gonna be your liquefactive necrosis. Dry gangrene is similar with your coagulative necrosis pero applied sa limb. Wet gangrene is coagulative plus liquefactive necrosis. Applied also in the limb. Very good. Don't forget that ha. That's a summary of what we discussed. Next, so this is now your gangrenous necrosis. Ito talaga guys, you will really see na necrotic na talaga, may certain parts na necrotic, and sometimes this is very common sa patient na may diabetic foot. Actually guys, I encountered a lot during my clerkship. So yung clerkship, yung mga 4th year medical student na. So we do our duty. So I was assigned at the ortho. So I was assigned in orthopedics na rotation. So if you're a clerk, of course, you have different tasks. So my task is to do dressing. So kami yung nagpapalit ng mga dressing sa mga patient namin. Tapos all the time we have to clean that. Every time assigned kami, we will be assigned to a specific patient. Then we always do daily wound dressing, and then it will really take a lot of time pag ganitong klaseng wound. We have to do a wet dressing, kaya binabasa namin siya kasi pag dry dressing, ang mangyayari, didikit yung gauze dito. So, mahirapan kaming magtanggal and masyadong mahirap. So, we have to really do that. And I have experience with one patient who has a diabetic foot and gangrenous, literal na may necrosis na talaga siya, guys. What happens is that I was actually in the ward pa. I'm doing my daily wound care sa mga patients ko. Grabe, sobrang tagal ko natapos. And then suddenly, they called for an ortho intern to the emergency room because may patient daw na pinapadress si doc. So, punta na ako. You know what? Ayaw talaga namin mga diabetic foot kasi literal guys, swear you can really smell, it's really smell bad because of the infection. Of course, ayaw mo naman ipakita sa pasyente na parang ayaw mo sa baho. Of course, tiis ka lang. Go lang. Of course, you have to still be compassionate. I mean, di ba kung ikaw na din naman sa lugar niya, ayaw mo namang mandiri ka sa kanya. So, of course, love serve pa rin. Okay, yes, sir. So this patient, grabe, as in, literal na how many days na hindi niya na kini-clean niya yung diabetic foot niya, or like it takes for how many months, hindi niya naglilinisan. As in, wala talaga, guys. So, nagpa-admit siya because the patient was probably septic, parang may fever na, may nararamdaman na. So, nagpa-admit siya. So, pag-check namin, yung pag-check ko sa paglinis ko sa kanya, as in, literal na sobrang paho, and also, hindi na nalilinisan araw-araw. So, I tried to take off the gauze, and then, dahan-dahan po, then, napapansin ko, parang sa periphery ko, parang may tumatalon. Hindi ko, hala, ano yun? Tapos, hindi ko tinahanap ko, parang tumatalon. And then try ko naman again, sige, dahan-dahan. Pero ako, as in, sobrang baho. Diyos, literal, ako like, tapos yung mga ibang resident or ibang areas, sinasabihan ako, Doc, bilisan mo na dyan para maakyat na yan. Kasi ayaw din lang ang baho. Kasi ang sobrang baho. Like, the entire area, the entire ER, ang sobrang baho because of the bacterial infection. So, dahan-dahan ko, tinatanggal-tanggal ko. Talagang sa periphery ko, parang may nakita ako na, parang may tumatalon. Ano yun? Tapos, hindi ko napansin. Guys, when I opened it, lo and behold, I've seen a lot of maggots. Literal na maggots na, as in lahat, may maggots dyan, may maggots dito, as in literal na gumagapang yung maggots. And I was shocked. And Doc, nakita yung ortho resident ko, sabi niya, oh yes, Doc, meron pong mga maggots. So, kunin mo lahat, linisan mo. Of course, I have no choice, but I have to do it because it's my job. It's part of my job. When we become doctor, we have to always be compassionate. No matter what the condition of our patient, we have to be compassionate always. Siya, dami. Si sir, tapos na, sir, daghan lagi kayo. Si sir parang wala lang. Hindi niya kasi nararamdaman kasi nagkakaroon na sila ng diabetic neuropathy, meaning they cannot feel anything in their pain. So, wala na silang nararamdaman. So, I try to take off a lot, as in literal, for how many hours, sobrang daming maggots na nakuha ko. And then, actually, the patient was suggested for BKA or below the knee amputation. Dapat tatanggalin na talaga yung buong area below the knee. Kaya lang ayaw ng pasyente, talagang nagrereklamo siya. Pero sinabihin, sir, reklam, wala naman ni mo ni ginalimpyuhan gani. Tapos dili pa jud ka na. Ti, paano na lang na kung hindi mo na siya pagtinluan, sir. So, ti, basi daw amo na ikamatay mo. So, sabi niya na, sige sir, limpyuhan lang nako na, blah blah blah. Sabi niya, sir, my ortho resident really wanted na dapat tanggalin niya talaga, but the patient insisted, so we just wrote parang consent na ayaw talagang ipatanggal ang kanyang paa. So what we do is that we do debridement. So I was also assisted my ortho resident. We try to remove the necrotic area. Sobrang dami, literal, umabot pa nga dito. Actually, this is not a picture, kinuha ko lang to sa internet. Tapos, we try to take off the necrotic area. Ang procedure is debridement. You take off the necrotic area and you do wound healing. So, for how many days and years, you know, how many days, months, you know what, no, when the patient followed up, as in literal na nag-heal. Actually, this is not a patient. Ito yung nakita ko. Pag tinanggal namin yung necrotic area, usually mag-heal talaga siya. Once there is a proper management, binibigyan ng saktong antibiotics, tapos tinanggal yung necrotic area, tapos may nilalagay na cream, talagang mag-heal siya. So, you know what, no? Despite those things, I was really shocked that after the patient went go home, ay siguro mga 2 weeks ata yung 2 weeks ata siya na-admit, and every day I was doing the cleaning, as in literal, no. You know what, the patient really appreciated my effort. For me, it was just not na, it was just na parang, yun lang yun na parang wala naman ako masyadong ginawa sa pasyente ko, pero the patient will really appreciate your efforts. Gaano kaliit ng efforts mo, your patient will really appreciate. And when the patient went out, binigyan pa nila ako ng fruits. Nahiya pa nga ako kasi yung resident ko hindi binigyan, ako lang yung binigyan niya. So, binigyan niya daw ako kasi nga daw, ako talaga yung naglilinis, ako talaga yung nag-take care sa kanya. And then, of course, the patient really appreciated it. So that's why when you become medical technologist or physician someday, you have to always be compassionate. No matter what condition they have, you always show to them na, you always show na you become caring with them, compassionate, love serves. Yun pa rin. So again, we're done with your caseous. Now we're done with your gangrenous. Let's proceed with your caseous. So caseous necrosis, it's a distinctive form of coagulative necrosis often seen in your TB infection. It is characterized by the cheesy white cross appearance of necrotic area, hence caseous. On microscopic examination, caseous necrosis exhibit a granulomatous reaction. So, merong granuloma formation. Yung granuloma ang caseous area, may amorphous granular debris composed of fragmented coagulated cells. The granular debris is enclosed within a distinct inflammatory border. Unlike in coagulative necrosis, the tissue architecture is obliterated. Very good. So again, tingnan natin ha. Pag caseous, tatandaan mo, coagulative necrosis. Tatandaan natin, it's also a coagulative necrosis in TB infection. So tatandaan, caseous, TB infection. So let's review again. Nag-ito yun, coagulative, intact yung architecture, pero a hypoxic happens outside the brain. Tapos, pag sinabi natin when hypoxic cell death happens in the brain, that is now your, ano nga yun? That is now your liquefactive necrosis. Yung gangrenous is also like your coagulative. It happens in the limb. That's your dry gangrene. Pero when it becomes a coagulative plus liquefactive, that also happens in the limb. That's gonna be your wet gangrene. Ang caseous naman is also a coagulative necrosis, pero usually sa may TB infection. Very good. So, ganyan guys ha. Always remember that. So, tingnan natin ang diagram na to. So, type of necrosis, caseous necrosis. So, caseous necrosis usually in your tuberculosis or in your lung. So, nakikita natin dito, tuberculosis of the lung. So, this is your lung. With a large area of your caseous necrosis containing your yellow-white cheesy debris. So, amorphous granular debris composed of your fragmented coagulated cells. The granular debris is enclosed with a distinct inflammatory border. So, ito yung caseous necrosis. So, tingnan natin dito sa cells. Caseous necrosis. Ito yung ating lung. Actually, this is a lymph node. So, this is your caseous necrosis or sa ating tuberculosis. This is your caseous necrosis. Very pink. You can see, it's a amorphous granular eosinophilic debris material. So dito yung ating caseous. And your caseous necrosis material is surrounded by different inflammatory cells. Meron tayong giant cells, meron tayong mga epithelioid cells. So, and these combinations of cells is what we term as now your granuloma. So your caseous necrosis is surrounded by your granuloma, and your granuloma is composed of epithelioid cells, giant cells, and other products. Very good. Fat necrosis. Fat necrosis is not a specific pattern denoting a descriptive focal areas or of fat destruction due to release of pancreatic lipases. So release fatty acid combined with calcium, visible chalky white areas, shadowy outlines of necrotic fat cells with basophilic calcium deposits plus surrounding inflammatory cells. So tatandaan nyo lang dito, fat necrosis, your release of your pancreatic lipases. In short, your pancreatic enzymes that have leaked out of the acinar cells liquefy the membrane of the fats in your peritoneum and lipases and split your triglycerides or esters contained within the fat. So in short, these lipases will degrade the different area sa ating katawan. So very simple. Fat necrosis related to your pancreatic lipases. Basta marinig ng word of fat necrosis, dapat related sa pancreatic lipases. Pag narinig ang caseous, it's also coagulative, pero sa lungs, physically your TB infection. Very good. Ito yung sinasabi ko. It is a fat necrosis in your acute pancreatitis. The areas of a white chalky deposit represent foci of fat necrosis with calcium salt formation or saponification at sites of lipid breakdown in your mesentery. So ito na yung ating sinatawag na yung mga white chalky deposits. Actually, we're done. We're done with that. So your fat necrosis, it's a special form of necrosis. Usually, we have, again, this is the last one sa ating types of necrosis. It's a fibrinoid necrosis. It's a special form of necrosis usually seen in immune reactions involving your blood vessels. It occurs when complex antigen and antibodies are deposited in the wall of your arteries. The immune complex, along with the leak fibrin, form a fibrinoid, amorphous, and bright pink structure. Excuse me. Ito yung tinatawag natin na fibrinoid. I know you're not still familiar with your immune complex kasi wala pa kayong immunology and serology. Pero dito, simple lang. You have an antigen, meron tayong antibody. So, it forms a complex. This complex will be deposited sa ating lining ng ating blood vessel. So, ito na yung mga immune complex, kaya nagiging pink na siya. So, ang tawag dyan is a fibrinoid necrosis. So, a fibrinoid necrosis in an artery in a patient with polyarthritis nodosa. So, the wall of the artery shows a circumferential bright pink area of necrosis with protein deposition and inflammation. So, yan lang ha. Fibrinoid, dapat usually immune reaction. We're talking about immune complexes, immune reaction. That's your fibrinoid. We're done with your types of necrosis. Actually, last topic na lang talaga tayo, guys. I know it's sobrang dami, pero almost done. We're almost done. So, again, let's review lang natin ha. Ulit-ulitin natin. This is really my style. Gusto ko talaga inulit-ulit para at least the more na inuulit ko, the more na maalala natin. Okay, coagulative. Doc, sawang-sawang na po kami. Memorize na po namin. Coagulative, intact ang kanyang outline. Tapos, ano nga yun? Hypoxic cell death that happens outside the brain. Pag hypoxic cell death that happens in the brain, that is now your liquefactive necrosis. Gangrenous necrosis is a type of coagulative necrosis na nangyayari sa limb. Pag coagulative lang, it is a dry gangrene. Pag coagulative plus liquefactive, that is a wet gangrene. Caseous necrosis, it's also a coagulative necrosis, but the outline is not intact, and also it's also commonly seen in TB infection, and there will be granuloma formation. Lastly, fat necrosis related to, tandaan lang, pancreatic lipases. And lastly, we have your fibrinoid necrosis, has something to do with immune complexes. Yung immune complexes natin na dideposit specifically sa ating blood vessel. Kasi nga, remember, special form of necrosis involving the blood vessel. Very good. We're done with your different types of necrosis. We will now proceed with your apoptosis. Guys, we are almost done. 69 of 79 of 79 na slides na lang tayo. Actually, mga less than 10, siguro mga 8 slides na lang to. So, apoptosis, this is another irreversible injury. So, apoptosis is a programmed cell death. Yan yung pinaka-definition natin. Apoptosis is a pathway of cell death in which cells activate enzymes that degrades the cell's own nuclear DNA and nuclear cytoplasmic protein. It's a process that eliminates cells with a variety of intrinsic abnormalities and promotes clearance of the fragments of the dead cells without eliciting inflammation. Little leakage of cellular contents, hence no inflammatory reaction. Kasi nga, remember sa apoptosis, remember natin yung apoptosis, nabubulol na ako. Gusto ko na talaga matapos to, guys, kasi paulit-ulit na talaga ako. Twice ko na kasi to eh. Nag-shrink yung cell. Therefore, pag nag-shrink ang cell, intact pa rin yung cell membrane. Since intact ang cell membrane, walang leakage or konti lang ang leakage, kaya walang inflammatory reaction. Meron tayong tinatawag na physiologic or pathologic apoptosis. Pag sinabi natin physiologic, it's a death of cells that no longer needed to maintain steady number of various cell population in tissues. Remember your red blood cells? Kasi once your red blood cells become senescent, it has to be lysed. It may be there will be undergo a macro, or it will be phagocytized by your macrophages. You also have your pathologic apoptosis. Your pathologic apoptosis, it eliminates cells that are genetically altered or injured beyond repair without eliciting severe host reaction, keeping the damage as contained as possible. So physiologic, this is normally happening. Pathologic, this is abnormally happening. This is brought about by a certain condition. So ito yung mga different condition that leads to a physiologic or pathologic. So physiologic during embryogenesis because nawawala na yung growth factor or turnover of your proliferative tissues. Nawawala na kasi yung growth factor, or pwede namang involution of your hormone-dependent tissues sa ating endometrium. Remember your endometrium? Remember your involution? Pag mababa na yung FSH and LH, it will not stimulate your uterus to increase its, or there will be no thickening of your uterus. So what will happen is that there will be a sloughing off of your endometrial cells. So that's why there is involution. Pag may involution, that is a physiologic response. So this is actually your menstruation. There is a decline of your leukocyte numbers at the end of your immune and inflammatory responses, and elimination of potentially harmful self-reactive lymphocytes. So this is a physiologic, so normally happening inside the body. Pathologic, once there is DNA damage, accumulation of misfolded proteins. Remember the accumulation of misfolded proteins, yung nasi-stress yung ating severe stress of your endoplasmic reticulum. Remember that, di ba? It will lead to apoptosis. So, mga slides na diniscuss natin will already explain this one. And also, infection, especially certain viral infection. Wait lang dyan, guys. Inom ako water. Sobrang sakit na talaga. Ang dami ko ng beses pumipiyok. Sorry. Inom lang muna water. We're actually almost done. We're now leading to our last two topics na lang, yung mechanism of your apoptosis, which is your mitochondrial and your death receptor pathway. So ito yung mga mechanism ng ating apoptosis. Apoptosis is regulated by biochemical pathways that control the balance of death and survival, inducing signals and ultimately the action of your enzymes called caspases, your cysteine proteases that cleave protein after aspartic acid residues. There will be two distinct pathways for the caspase activation, your mitochondrial pathway and your death receptor pathway. Dok, bakit kailangan nating caspase activation? Your caspase is the enzyme that will completely destroy the cell. So, kailangan natin ma-activate yung caspases. So, ang end effect, kahit iba-iba sila ng pathway, ang end effect pa rin nila is to activate your caspases. Sige, unahin natin yung mitochondrial pathway. So, yung mitochondrial pathway or your intrinsic pathway, tinawag siyang intrinsic kasi nga nasa loob. Remember, your mitochondria is within or inside the cell. So, in your mitochondrial pathway, responsible in most physiologic and pathologic situation. It involves your cytochrome C. Remember, your cytochrome C is within your mitochondria. Ang trabaho ni cytochrome C, it is a protein sa ating mitochondria that is capable of inducing apoptosis. It leaks out in the cytoplasm when your mitochondrial membrane becomes permeable, activate caspase, and triggers apoptotic death. Tingnan natin. So, this is now our pathway. So, ito yung normal cell. This is the normal cell. So, let's talk about your mitochondrial pathway, ha? This is the normal cell. Ang normal cell, of course, nabubuhay yan because of the survival signal. So, ito yung plasma membrane. Ito yung receptor ng ating cell. So, nabubuhay ang ating cell, so a normal cell, because of the survival signal. For example, nating survival signal, growth factor. So, your growth factor will attach to the receptor. Anong nangyayari? Pag naka-attach ang ating growth factor sa receptor, it will yield to the production of your anti-apoptotic protein. Again, meron tayong survival signal coming from your growth factor. Si growth factor mag-a-attach sa receptor. Ang trabaho ni receptor nito, once they already attached, they will induce production of your anti-apoptotic proteins. Ano yung anti-apoptotic proteins? Example niyan is your BCL2. Tandaan lang ha, BCL, anti-apoptotic, meaning pipigilan mong mamatay ang cell. Ayaw mong mamatay ang cell, ayaw mong mag-undergo ng cell death ang cell. Kaya nagpuproduce ka ng BCL. So basta BCL, automatic, BCL, anti-apoptotic. Next, anong trabaho ni BCL? So your BCL or your anti-apoptotic will actually inactivate your BCL, your box channel or your box or back channel. So tingnan nyo, yung color green na yan, that is actually your box or back channel. Ayaw mo yung box or back channel. So, si BCL2 na ating na-produce is i-attach siya sa ating box or back channel para hindi lumabas ang cytochrome C. Doc, bakit ayaw nating palabasin si cytochrome C? Kasi nga, si cytochrome C, ano nga ang trabaho ni cytochrome C? It will activate caspase, triggers apoptotic death. So in short, pag lumabas to si cytochrome C, then it will induce apoptosis. Kaya, kailangan si BCL2 para walang apoptosis na nangyayari kasi si BCL2 is attached sa ating box or back channel which is the color green. Pinipigilan niyang lumabas yung ating cytochrome C. That is a viable cell. That's a normal cell. Pero Doc, what if a cell will undergo apoptosis? Ano po bang nangyayari? Ganito ang nangyayari. Pag nangyayari ang apoptosis, there could be lack of survival signal. Pwede, wala na tayo growth factor. That's your lack of survival signal. Or, pwede, brought about by irradiation. Remember, apoptosis can happen in a physiologic or pathologic condition. Example ng physiologic condition, lack of survival signals. Example ng pathologic condition that will lead to apoptosis, it's your irradiation that leads to a DNA damage. Both of these will lead to the activation of the sensor. Doc, ano po yung activation of sensor? Example of activation of sensor is your BH3 only protein. Anong trabaho niyan, Doc? Remember, pag wala ng growth factor, wala ng signal. Or pwedeng mayroong DNA damage, na-activate yung BH3. ang trabaho ni BH3 is to antagonize now yung BCL. I-antagonize niya si BCL. Remember, BCL is anti-apoptotic. So in short, your BCL cannot do its action or cannot attach to your box or back channel. Remember, your box or back channel will be the signaling channel so that your cytochrome C goes out of the mitochondria. In short, your box and back channel is pro-apoptotic. Gusto nilang mangyari ang apoptosis. So, through the activation of your box or back channel. So, lumalabas na yung cytochrome C. Again, ano nga ang cytochrome C? Yung cytochrome C will be responsible for the activation of caspases so that apoptosis will happen. So, that's the beauty of your mitochondrial pathway. Review lang natin na paano nangyayari ang mitochondrial pathway. Intrinsic. Pwedeng walang signal or pwedeng DNA damage. It will yield to the activation of your BH3. Si BH3, i-antagonize niya si BCL. So in short, si BCL, hindi siya mag-attach sa ating box or back channel. Anong mangyayari sa box or back channel? Your box and back channel is pro-apoptotic and it will be activated. Therefore, your cytochrome C will leak out in your mitochondria, leading now to the activation of your caspases. Therefore, apoptosis will occur. So that's how you explain apoptosis in a mitochondrial pathway. Another pathway naman tayo, we're almost done. Second to the last na lang talaga to, guys. We have your death receptor pathway or your extrinsic. So that receptor pathway, we are talking about outside the cell. Kanina, inside the cell. Ngayon, sa outside the cell na tayo. Within the many cell expresses surface molecules called now your death receptors that triggers your apoptosis. Most are members of the tumor necrosis factor family, which contains in their cytoplasmic region a conserved death domain. It mediates interaction with other proteins involved in cell death, involved in the elimination of self-reactive lymphocytes and in the killing of target cells by some cytotoxic T lymphocytes that expresses your fast L. What's that? I don't like that. I don't like that description. Gusto ko yung diagram. Mas easier kasi, you know what is, no? When you read, parang, technically napaka-boring. Pero when you see the diagram, you will really appreciate it. Tingnan natin, yung death receptor pathway. Ang gusto lang natin sa death receptor pathway, simple lang naman, guys. Your fast L molecule are being cross-linked with your fast molecule. Ito, si fast L mag-attach sa ating fast molecule and they will bind to a adapter protein via your death domain. As simple as that. Attach lang si fast L sa fast via your adapter proteins and then they will attach in your death domain. And that's it. It will now activate your caspases and will undergo will undergo now your apoptosis. Nakalimutan ko na tuloy, guys. So that's it. As simple as that. Your fast L will attach to your fast to your adapter proteins in your death domain. Then after that, it will now activate your caspases so that there will be apoptosis. Actually, when you read the book, it's very technical, guys. May caspases 8, caspases 6. Actually, may initiator yan. Initiator 1, 2, 3. Tapos, ang executor is yung mga matataas na number ng caspases. Caspases 11, 12, and 13. Pero at your level, I don't want you to memorize that. It's too technical. Kahit na sa amin na sa medicine, hindi siya masyadong tinatakal. So for at your time, at your level right now, since this is not med school, please do not memorize that. Ito lang yung diagram na gusto kong malaman nyo. What I want you to really learn is the concept. I don't want you to memorize everything. I just want you to understand the concept. Yun talagang gusto ko, okay? So this is my last slide. This is now the summary of the mechanism of your apoptosis. This is actually the combination. Paulit-ulit lang to. Mitochondrial intrinsic pathway. Remember your BCL to BCL and then it will prevent your BCL. I know you're already familiar with that. You can just review na lang this one. So your mitochondrial and your extrinsic pathway. Ano ang end effect nito? Ang end effect nito is basically to activate your caspases to do now its action of endonuclease activation, breakdown of cytoskeleton. In short, you are going to degrade now your cells. this is now your apoptosis using now your mitochondrial and that receptor extrinsic pathway. That ends our video lecture. But before that, let's review first if we were able to attain our learning objective for today. Remember, have we defined the different terms associated with pathology? Of course, we are now able to define pathology. Ano nga yung pathology? Simply the study of suffering or the study of disease. And of course, the four aspect of disease process, you are very familiar with that. Ano nga yun? Etiology, the cause. Pathogenesis, the mechanism or the different events or progression of the disease, which will lead to different morphological changes. Because of these morphological changes, the function of the cell will be affected that will lead to different clinical signs and symptoms. Very good. Ano nga yung different division and scope of pathology? We have your general and special. General, meaning it can happen in different organ. Same response of the cells that can happen in a different organ. Pag sinabing systemic or special, we are talking already of a certain organ disease. Of course, we were able to discuss the different cell injury, differentiate the types of cell death. Ano nga yun? Yung necrosis and apoptosis, or galing na tayo dyan. Then we were able to explain the mechanism in cell injury. And lastly, we were able to identify the different microscopic changes, reversible and irreversible, and identify the different types of necrosis. I guess we were really able to attain our learning objective for today. So I guess that ends our video lecture. I hope that you learned something from today's discussion. I know I'm very sorry guys na it's very mahaba. I guess almost 3 hours. I'm very sorry. Parang napa-enjoy yung discussion ko. But I hope na you appreciate the beauty and importance of pathology, and most especially you will really able to apply that into histopathology. So I guess if you have any questions, please do not hesitate to ask me. You can post that through our Canvas account. Meron tayong content forum. You can ask me a lot of questions on that para at least some of the students will be able to know your questions also. Or you can simply comment or ask me questions with my different social media account. You can chat me anytime. Swear, during sa mga third year students ko, sinasabihan ko sa kahit umaga na, kahit gabi, kahit anong oras, you can simply PM me anytime, and I always reply as fast as I can as long as I am able to. And I hope you really had fun and enjoyed his general pathology and your cellular injury and death. So with that, I guess for our quiz this coming Friday, please read the book. After watching this, guys, promise you will really appreciate what you learned here. Kasi mabilisan na lang yung basa kasi naiintindihan nyo na eh. And I guess you don't need to go into the parang molecular level. Pag hindi ko na yan diniscuss ng molecular level, please do not include that. But if you still want to read, of course, that will also help you. And again, I hope that you appreciated this lecture video and you learned something from today. And one thing for sure, to always na please always be kind to your teachers, always be kind to your classmates, and above all, be kind to yourself. Happy Aral everyone. Thank you and God bless you.